Access to safe drinking water, sanitation, and hygiene is fundamental to human health, well-being, and dignity. However, the journey towards universal access to these vital water, sanitation, and hygiene services, also known as WASH, in Uganda has stagnated. Millions of Ugandans are still suffering from the health impacts of poor sanitation and hygiene. Millions more still live without sustainable access to safe water or are threatened by floods, droughts, landslides, and other climate-related hazards. Without sufficient WASH, many Ugandans will continue to suffer from poverty and disease, food and energy insecurity, and reduced economic growth. Over the past 4 decades, WaterAid Uganda, in collaboration with partners, has been on a mission to transform lives. We've reached schools, healthcare facilities, and communities, leaving a trail of positive impact in our wake. Yet the challenges persist. According to the 2020 Joint Monitoring Program report, only 56% of households have access to basic drinking water services, while sanitation and hygiene levels remain at 20% and 23% respectively. In response to this critical gap and the evolving global landscape, WaterAid Uganda proudly presents its new Country Program Strategy 2023 to 2028. Our strategy is not just a blueprint. It's a commitment to building a healthier, more resilient Uganda. By 2040, the government of Uganda envisions a modern and prosperous society. We share this vision, and our strategy focuses on 2 core aims to make it a reality. Aim 1. Position WASH across the health sector to improve public health. Why this aim? Health is an important determinant of economic development in Uganda. It is underpinned by levels of income, education, housing conditions, access to safe water and sanitation, cultural beliefs, social behavior, and access to quality health services. A healthy population means higher productivity, and the importance of human capital to economic growth cannot be overemphasized because it serves as a catalyst for economic development. Malnutrition and poor WASH access are among the top risk factors for morbidity and mortality in Uganda, with 75% of the disease burden in the country being preventable through health promotion and disease prevention. The integration of hygiene behavior change into core public health programs and policies is critical. Access to sustainable and safe WASH in communities, households, schools, healthcare facilities, and public places is fundamental to improving health outcomes, providing quality care, and preventing avoidable deaths. How will we achieve it? WaterAid Uganda will prioritize strengthening health systems and influencing the government to prioritize WASH across the health sector in order to improve public health. This is in response to the government's shift in directive from curative to preventative healthcare that is yet to be operationalized at policy level despite the political will. 1. We will generate evidence to advocate for adequate budgets for WASH in public health and promote leadership and responsibility for WASH. 2. We will work in partnership with government to integrate hygiene behavior change into core public health programs and policies. 3. We shall focus on enhancing service levels to deliver inclusive WASH in public health care facilities in a bid to improve the quality of care. And finally, we shall invest in championing effective coordination among donor partners and state and non-state actors in WASH within public health. WaterAid Uganda aspires to see all of these efforts scaled up and adopted by more partners working on WASH and health. Aim 2. Strengthen the resilience of WASH to climate change. Why this aim? Uganda continues to be exposed to the impacts of climate change and increased climate variability. The country is experiencing increasing environmental degradation. Increased demand for water due to low rainfall and drought is causing other water sources, including boreholes and springs, to dry up and is affecting the quantity, quality, and availability of water. Conversely, Heavy rainfall and flooding, especially around the mountainous regions of Elgon and Rwenzori, have over the years damaged water sources and sanitation facilities. Runoff and waste ends up in streams and lakes, contaminating water supply sources, especially in the lowlands. Our aim is to make wash services and behaviors resilient to climate change. We want to ensure that communities can cope with existing and future climate threats and maintain water security, access to sanitation services, and follow good hygiene practices. How will we achieve it? Together with partners and stakeholders, we will influence and advocate for climate-resistant wash to be integrated into climate change policies and plans. We will support communities to adapt to ensure wash services and behaviors are resilient to climate change. We shall influence allocations and investment of sufficient funding from the government, donor partners, and the private sector for climate-resilient wash programming. What approaches will we use to achieve these ambitious claims? WaterAid Uganda's approach is built on 5 key aspects that cut across our aims. Approach 1. System strengthening for sustained service delivery. Partnerships and alliances. The achievement of Sustainable Development Goal number 6 will only be possible through collective action and leveraging the strengths of different actors. Advocacy and influencing. The country program prioritizes a human rights-based approach to WASH, empowering marginalized groups, especially women and girls, to demand their WASH rights. Gender equality and youth empowerment. Promoting gender equality and empowering women and girls is at the core of our approach. Evidence, learning, and innovation. We're building our foundation on detailed system analysis, evidence generation, and innovation. Striving for universal WASH access in Uganda by 2028 is achievable, and we are fully committed to this mission. Together, we will be a driving force, taking on various roles to inspire change. We will actively seek knowledge, generate evidence, and promote action and innovation. Join us as we work to build a healthier, more resilient Uganda where everyone has access to safe drinking water, sanitation, and hygiene.